Hello and welcome back. I'm excited to welcome you to our next session, LGBTQ plus youth, integrating a deeper look at Maine Integrated Youth Health Survey data and minority stress with building resilience to inform prevention. My name is Becca Bolas and I'll be moderating today's session. A few reminders before I introduce our speaker. The first is that we are offering conference captioning services. Within each session, you'll be automatically provided with the service, which is underneath the video stream. If you don't need the captioning service, you can just push the pause stop button and it will stop. The second is to please be sure to complete the session evaluation. It's just 4 short questions and your feedback is very helpful to us and to our speakers. And it is required if you're seeking continuing education credits. And the third update is that there is a poll in this session. Thank you, Joanne, for some engagement. To access it, you'll have to click the poll button, which is on the right side of the stream, and it's in between the Q&A and feedback buttons, which I really hope you're familiar with by now. So with that, I am now excited to introduce our speaker. We are joined today by Joanne Joy from Healthy Communities of the Capital Area. And with that, Joanne, I'll turn it over to you.
Thank you, Becca. Hello, everybody. Nice to not see you this afternoon on this beautiful day. I am going to first just say my disclosure that I have nothing to disclose with regard to commercial relationships. And to recap what you'll learn about in this presentation. So we have been engaged in an LGBTQ plus youth tobacco prevention project, having completed almost a year of a community needs assessment project. And by we, I mean HCCA, which is Healthy Communities, and Out Maine. We are 2 community partners. Maine CDC has selected LGBT prevention and control as a priority effort. And we've been working with CTI in this community project. We took a deeper look at Maine Integrated Youth Health Survey data that tells part of the story about the lives and use of tobacco and other behaviors. We're going to take a quick look at minority stress and building resilience. And then we'll learn about some additional LGBT plus youth efforts, supports, and resources that you may be able to tap into and certainly learn more about. So HCCA has 20 years of expertise in tobacco prevention and control. And we've had a focus on LGBT tobacco use off and on as resources have been available and as data has been created. LGBT data has not always been tracked. So we have built the data, found the data, et cetera. And Out Maine has actually 25 years of direct support for LGBTQ youth in Maine. They're located in Rockland and do a lot of direct support for youth, also for schools, parents, and other systems. So HCCA is a public health nonprofit located in Gardner. We have staff of just 11, but we have over 75 partners. Our work is always data-driven and evidence-based. We focus on primary prevention with funding from state, federal, and foundations. Equity is a core value. HCA has a set of core values, and LGBT plus youth and adult tobacco use and other projects over time reflects that core value. And generally, we serve Southern Kennebec County or Kennebec County, sometimes Central Public Health District, and sometimes statewide projects. As we know, the funding for public health in Maine covers different geographic areas. So here are our core values, and these are also on our website. And I find them important to present here is because I believe our prevention efforts work because of our authentic engagement, because we do have a sense of place. Our work is in Maine. Equity for us is about poverty, racism, and other societal inequities. And we do prioritize the people most impacted by whatever condition or social determinant. We are honest, dedicated to our work, and well-being really sits at the intersection of individuals and their environments. So we keep all of that in mind. Out Maine has 4 pillars: safe and welcoming communities, informed and supported families, safe and affirming schools, and strong educated provider safety network. They engage with youth with weekly online groups. So currently, because there is so much online, youth from across the state can connect with the support groups, the activity groups, etc. And there are weekend retreats and the Rainbow Ball weekend. If nobody's heard of the Rainbow Ball, it's a great opportunity for youth from around the state to get together. Unfortunately, it was not in person last year, but still together, supporting parents and families, creating welcoming and affirming schools, and then, of course, working with other professionals, regional training, individual school organization training, etc. So much of the work that I'm presenting today really comes from the community needs assessment. The US CDC said to the states a while ago, identify a population with tobacco use and related health disparities. Maine identified the LGBT population, in part because we really have robust youth data that not every state has. And those data sets of high school students who self-identified by sexual orientation and gender identity allowed a deeper cross-tab analysis, including vaping use, smoking, other tobacco products. And we integrated marijuana into it, even though it was a tobacco-related project. At this point in time, the crossover with vaping in particular makes it impossible for anyone to tell if it's a nicotine-related product or a marijuana-related product. And of course, smoking is smoking for many of the consequences of use. And of course, we looked at risk and protective factors. So the community needs assessment really looked at the LGBT plus youth as a community of shared experiences and identities. We acknowledge that schools are still where most LGBTQ youth are found. There are few LGBTQ youth supports outside of school settings. We included a look at the Maine Integrated Youth Health Survey's LGBT Not Sures data. So there is no question that says, in MIYHS that says, are you questioning your sexual orientation or gender identity? But it does say, are you not sure of your sexual orientation, or are you not sure that you are transgender? 4% of the respondents in 2019 were not sure about their sexual orientation, and almost 2% not sure of their gender identity. We did a literature review that included LGBTQ plus and resilience. So what Out Maine said all along was, no matter what else we're doing, we're building resilience. Can we not find some connection between prevention and resilience? We ended up doing a lot of work around the theory of minority stress. So it was in the 70s that the initial theory of minority stress had some published data on the impact on LGBT adults of minority stress. There's also a lot of work done around minority stress on communities of color, on other minority groups, but it was originally developed to describe why there are higher rates of substance use, mental health, etc. And it was very useful in us being able to explain to our advisory council and others this additional use and risk factors. We also looked at the Trevor Project for other prevention observations. The Trevor Project is a nationwide suicide prevention project, which has had a lot of success in reducing suicide among LGBTQ youth and young adults. And we use a multi-sector advisory council to help frame recommendations. So this is where I'm stopping and saying the poll on your right is where you can look for the way to answer this. So across Maine high schools, most schools participated in the Maine Integrated Youth Health Survey. This is in the results from 2019. What percentage of these high school students do you think identified somewhere under the LGBTQ plus umbrella? 9%, 11%, 14%, 17%, 20%, or 23%? We'll wait a couple minutes while you all find the poll button and enter the percentage that you think is accurately reflects the number of students who identify under the LGBTQ plus umbrella. And it looks like one more 20 seconds for people to enter their results if they haven't already. I see the numbers changing. If I count from 10 to 1, will everybody have answered? 10, 9, 8, 7, 6, 5, 4. I don't see the numbers changing anymore. So I think, oops, 3, 2, 1. So I see we actually have answers for every percentage level. Let's go to the next slide. So in 2019, under sexual orientation, the category of gay or lesbian was 3%. The category of bisexual was 10%. Not sure was 4%. That's 17% identified as either gay or lesbian or bisexual or not sure. Under gender identity, yes, I am transgender, was actually 1.6 rounded up to 2, or not sure if I am transgender, was an equal number of youth. So that's approximately 3.5 to 4%. So you cannot add the sexual orientation not sures and the gender identity not sures because they could be some of the same people. You know, it's not like they're an additional group. So it's very difficult to add all of these together, but we are talking somewhere in the neighborhood of 19 or 20%. In this slide, we have divided out smoking rates, divided by the sexual orientation and gender identity categories. The blue line shows Maine high school students, all of them, including those that identify as LGBT and the not sures. So you can see in 2019, 7% had smoked in the last 30 days. But of those people, about a third of them had started smoking before 13. There were still 4, 5, 6% using snuff, chew, smoking cigars, little cigarettes, etc. Some of these could be the same people, of course. And then the two questions about exposure in the same room with someone smoking or in the same car, you can see is quite higher. But when you look down at gay, lesbian, bisexual, not sure, transgender, etc., you can see how much higher the rates of use and of exposure among LGBT youth. So there's nothing wrong, inherently wrong with LGBT youth. It is this additional level of stress experienced by all teens and this minority stress level. If we looked at these questions, we can see in 2019, this data set is non-LGBT, those who use tobacco and then those who use marijuana. In the past 30 days, non-LGBT, 6% had smoked cigarettes, 13% of LGBT. And of those LGBT who had ever used, over half of them had used in the last 30 days. And the marijuana smokers had also used at a higher tobacco at a higher rate. The same for electronic vapor device. So there's not significant difference between non-LGBT and LGBT in actual use. But of those who use tobacco, 93% were using vape products. 71% of the marijuana users were using a vape product. Of those who used any tobacco in the last 30 days, 44% LGBT, and 83% of those who smoked were also marijuana users. So you can see the reasoning that this project had around tobacco prevention to also put on the marijuana cap around tobacco, smoke, and vape at the very minimum. What I also would like to draw your attention to is the final question, which is I definitely probably would smoke if one of my best friends offered a cigarette. And you can see that that's significantly higher for LGBT youth. There is a need to belong to your community, and you would say yes if somebody offered you, and we're at 45% there. So here's some risk factors. Again, wanted to leave home because of violence in the home. These are the same kind of data as in the prior slide with this color designation. So all of the Maine high school pieces are very high. 21% of kids wanting to leave home because of violence or being bullied, 23%, sad or hopeless for more than 2 weeks in the past 12 months. These are all very high and are concerning all by themselves. And people who are talking about mattering and resilience, et cetera, can certainly see all of this data as need for all of our kids to be supported and to build resilience and to feel they matter. And transgender kids wanted to leave home because of violence at a rate of almost 50%. 71.7% sad or hopeless. Seriously considered suicide, over half the transgender kids. And this is, consistent with what we've heard around the country as well, but Maine is unique in collecting so much good data. Here's a couple of protective factors. So this is percentage of students who reported feeling sad or hopeless, but got help from an adult in the past 12 months. This is, consistently around a quarter or a little more than a quarter. And it seems the LGBT kids actually went to their teachers more than the others for support. That is a strong reason to support GSTAs and other supports in schools. I wanted to point out too, the percentage of students reported that they felt they mattered to people in their community. In general, it's low enough, 56.6%, but again, we're down to 43%, 35%, 32% among LGBT. So very often we treat our LGBTQ populations, whether they're young or old, as kind of this monolithic group of minority, gender and sexual orientation minority people. This really helps us in our prevention planning to say, wait a second, if it is the transgender students who are X, Y, or Z, perhaps we should really create an intervention for transgender students, for bisexual students. And even though the MIYHS collects data about whether you are gay or lesbian, we are very sure that there are significant differences between gay and lesbian as well. And that will be teased out more in focus groups and in surveys. So here's another time for you to think about why. So for the first two questions, maybe you can just jot down a couple of ideas about what about the general culture and environment might be contributing to LGBTQ plus youth being at higher risks, having fewer supports and more risky behavior. You might want to think about what local conditions in youth serving organizations, social services, retail businesses, churches, sports, the whole ball of wax about what surrounds an LGBT youth, what local conditions contribute to those disparities. And then I would like you to say, what changes in your local communities can you make to increase the protective factors. This is similar to, the question about what can you do to help youth feel they matter? What can you do to help youth heal? So I can't see the chat, but I am hoping that people are taking a few minutes to put into the chat what changes in your local communities can you make to increase the protective factors for LGBTQ plus youth. And Becca, if you see a couple that you could just read out, that would be great.
Yes, we'll do.
While Becca is watching for things in the chat, I do want to tell everybody that if you are not familiar with MIYHS, you can go into the reports and find what you were interested in. Are you interested in our kids eating healthy? Are they exercising? It's not just about mental health. Are you interested in what's going on with different ethnic and racial groups? Are you interested in it in a school system? Then you need to talk to the superintendent or the principal. But this data exists, and a lot can be done for you to identify what you want to identify in the data. So I just want to say a few things about minority stress. So it's unique in that it's related to the identity or perceived identity, not the person specifically. It's chronic. You can expect minority stress any time, any place. It's not specific to one person or even a time period. You can see it in old movies. It's socially based, not inherent in the individual person, and experienced as stigma, discrimination, violence, homophobia, biphobia, etc. However, in building resilience, much of the resilience data from the early 60s, talking about resisting tobacco use, preventing tobacco use, really breaks down into three areas. One is the individual area, general characteristics of the individual, as well as these learned skills and knowledge, as well as positive experiences. This is the way we help youth understand they matter. Interpersonal relationships, identify strategies to improve relationships with family members, friends, peers, near peers, mentors, teachers. And then, of course, we have these external structural factors, school policies, elements of a school climate. So you may have great school policies, but they're not really enforced. Community resources, social media has some very positive reflections of LGBT youth and some very negative ones. And we don't know what's going on around behind the scenes bullying on a day-to-day basis. What we also learned, however, is that belonging to an LGBT community, having an identity that you're proud of, if you can be out, and if you have LGBT social supports, those things actually counteract the lack of support and acceptance in other areas such as family, school, and the greater community. Another great asset for GSDAs. It also appears to have support positive mental and physical health, and what I thought was interesting, increased receptivity to health promotion of all sorts, even in the absence of those more traditional social supports that we kind of rank in the Maine Integrated Youth Health Survey data. We, of course, need more research in that area. The peer-reviewed research in this area is quantitative, and recruitment has been among individuals already with some involvement with the LGBT plus community, because it's been, snowball recruitment, et cetera. I'd also like to say that there's very, very, very little LGBT youth research that has a youth voice in it. Our guiding principles include combining increasing resilience with whatever evidence-based prevention or treatment strategies you have, and to engage LGBT youth in the planning and use peer messages and peer or near peer messengers. We're going to create an at-a-glance model to highlight the need for increased resilience as core to any prevention project. The Trevor Project has this one, which we find very useful in explaining to people about understanding resilience. And of course, we want to say prevention does not stand alone. With the number of LGBT youth already using nicotine, then we must integrate treatment as prevention. If your social network, if your peers could offer you a cigarette or vape pen or whatever, and you are more likely to say yes, that all by itself is a huge risk factor. So this is also from research, a meta-analysis of what treatment is needed for LGBT individuals. This was for young adults. And I'm going to lead you through a couple of other supports. If you do not know about the LGBTQ plus Support Me network, you are invited to join the group. It is totally run by people who are generally in prevention, trying to increase each other's skills and cultural competence to provide prevention effectively for LGBT youth across the state. Some people are working in, Let's Go. Some people are in district youth coordinators. We have a couple of mental health providers, medical providers. The meetings are virtual and currently the first Wednesday of every month. And you could contact April Hughes or me for that matter. We host out of HCCA. The website is very useful. It gives a lot of data. It also gives a lot of resources, and the resources are kind of being relabeled a bit so that there's more information. All of the links were checked recently, so they are good to go. Healthcare professionals, educators, all have those resources. I would like to say again that you do have access to the MIYHS data. The report is over 700 pages, so you do need to learn the search function. The LGBT Not Shores is for high school only, but it's reported at the statewide public health district and county levels. School level reports may not have adequate numbers of LGBT kids to have school level data. We have used Southern Kennebec County a lot for, like in this area. And there are great fact sheets. If you haven't been on this website, there are great fact sheets created by Maine CDC and DOE. This is an example of one. This is the front and back about, general health. And do we have questions or comments? Becca, do you have some comments about what people could do in their communities from the chat?
Yep. We do. There's a few comments. So establish gay, straight, transgender alliances in schools, more identifiable LGBTQ role models. There's a comment that despite progress in general media and among adults, there's still a lot of debate, and there are quotation marks around that, about whether being gay, lesbian, or bisexual is right. And there's quotation marks around the word right. There's a comment about seeing more rainbow flags and lists of minority groups that include LGBT lawn signs and rainbow visible LGBT ally signs on businesses and providers' offices so that wherever someone goes, their environment is signaling acceptance. There's a comment about creating safe spaces for LGBTQ plus youth and ensuring that folks that engage with youth and sponsor youth programming are educated on how to create safe spaces, and getting more towns and cities involved in Pride-related events, including LGBTQ plus youth in the planning and implementation of Pride events and activities. There's a lot of comments in there.
Yeah, excellent. Any questions?
There are some questions. Let's see here. I find that there's a lot about the tobacco and marijuana use. One of them is, I find the statistic about LGBT youth more likely than non-LGBT youth to smoke interesting, but not surprising, given what we've learned in earlier sessions today about connectedness, mattering, and community. How can we promote more feelings of connection about LGBT? And I think, certainly some of those were in the comments in the chat, and then anything else you'd want to add to that, Joanne, about promoting feelings of connection.
Yeah, thanks for that. The feeling it's very interesting to me as an out lesbian myself about how people don't even out themselves. You know, if you were to ask everybody, if we were all in a room and just asked everybody who fell under the LGBTQ plus umbrella, it would still be uncomfortable for some people to raise their hand or to stand up. A lot of making it safer for our youth is being more out ourselves and letting folks know that, you know, we are successes, we survived youth, all of that. Additionally, I think it's difficult in schools for them to see microaggressions. And we need to learn more about the day-to-day microaggressions. I think schools and other policies have really tamped down on some really blatant things, although there's still a lot of bullying. But the microaggressions are significant. And people don't realize they're doing it. I experience them with very well-intentioned people. So it's learning more about microaggressions. It's supporting your school, letting your school board know that you support developing a GSTA at the school and how can you help support that would make a big, you know, it really makes a big difference. And Outmain does a lot of trainings. If any group would like a cultural awareness 101 to just, you know, kind of learn, say this, don't say that, that would be a good thing to do. And we have a couple of trainers at the Gender Clinic in Portland and at Acadia Hospital in Bangor as well that are great with that for different professions, for mental health and healthcare professions as well. I know that we're wrapping up. I do have my contact information if anybody wants to get in touch with me. And because we are doing more and more all the time to expand supports, we are just embarking on a United Way funded project just in our service area to increase summer programming, because LGBT kids get lost in the summer because they may be in unsafe settings or not have a way to connect with their peers once school closes its doors. So we're working on that, and I'll be delighted to be able to present next year on the successes of getting more summer programming up and why we're doing that.
We'll look forward to that session as well. Thank you so much, Joanne. There have been a couple other comments and a couple questions I didn't get to. So if you want to peek into your session afterward, you can see what those are. But I do want to thank you again. This was a very informative and sobering presentation, and I do think it generated some good discussion and ideas in the chat, which is, you know, always a goal, certainly in a virtual setting, to have that. So thank you very much. I do just have a couple of comments to make. First, I want to thank everybody who was here in this session. Please don't forget to complete the evaluation. We will be back in 10 minutes or a little bit less than 7 minutes with our next session, outreach efforts to enroll people in main care expansion. So thanks again to Joanne and to everybody for being here, and we'll see you back at 3:20 p.m.